My name is Dr. Beintaris. I'm one of the consultant gastroenterologists in Northeast. Today I'm going to walk you through your upcoming polypectomy procedure. So what happens before your procedure? One of our pre-assessment nurses will contact you to discuss the procedure with you, and you will also be receiving your appointment in writing with details on the date and time. We will also be posting you the relevant procedure information leaflet together with a consent form for your reference and perusal before you attend on the actual day of the procedure. Sometimes we may need to ask you or organize for you to attend the hospital or your surgery to submit some blood samples as part of preparations for your procedure. Rarely, we may also deem that a scan is appropriate for you to help us assess your pathology before actually removing it. We will be sending you laxatives for you to drink the day before your procedure. In rare cases where patients have a constipation history, this laxative regimen may be extended to a few more days. So what is the ESD technique for polyp removal? ESD stands for endoscopic submucosal dissection. It is different to the DMR technique with regards to the fact that instead of using a snare to remove the polyp, we have the means to use an electrosurgical, as we call it, knife in order to start cutting underneath the polyp and eventually remove it as a single piece. So what is a polyp? A polyp is an abnormal growth that may develop inside your bowel, usually what we call the large bowel or colon. So why do we need to remove polyps from your bowel? Polyps are abnormal growths that may have the potential to become cancers if left behind in the future. They also have the potential to cause symptoms that may cause you trouble, such as diarrhea, constipation, or even bleeding and anemia. Therefore, if you have been deemed appropriate to have your polyp removed, you should strongly consider it to mitigate those risks. So what will happen on the day of your procedure? Once you have arrived, you will inform our reception that you are at the endoscopy unit, and you will be greeted by one of our endoscopy nurses who will lead you into what we call an admission room. This is where we will take some time to go through your comorbidities, medical issues, and medications before proceeding to the consenting process. During the consenting process, either your doctor or one of the qualified nurses will walk you through details about the procedure, including risks, and if you're happy to proceed, you will be asked to countersign the form. Once this process is over, you will be asked to wait in one of our waiting rooms until your endoscopy room is ready for the procedure to start. So what are the risks involved in a polypectomy procedure? As with any procedure, especially an interventional one, there are always some risks which you need to be aware of. It is worthwhile noting that these risks are not common, but they do occur. Risks that we may encounter during a polypectomy procedure might involve pain during the procedure, bleeding, a tear in the bowel, or in medical terms, a perforation, and some sedation risks in case you opt to have sedation for the procedure. It is important to know that these complications are not common, but if they occur, they may potentially have serious implications, in which case we may opt to keep you in the hospital overnight for monitoring and further management. You will be having the chance to go through more details on these complications in the patient information leaflet that will be posted to you when your procedure is booked. Are there any alternatives to your polypectomy procedure? One option is not to remove the polyp by accepting the risks that this polyp entails. As mentioned earlier, polyps do have the potential to grow in size and also give rise to cancers. Therefore, if you opt to have your polyp not removed but left in your bowel, this is a risk you may need to accept. Another alternative, if the polyp is eventually deemed appropriate for resection, is a surgical operation that can be done either with open surgery or a keyhole surgery. Obviously, surgery is a more invasive technique, and if you eventually contemplate this option, there will be a different assessment pathway for you before the procedure is undertaken. So what happens during your ESD procedure? Before the procedure, the endoscopist will administer some sedation for you. Usually this suffices for most cases of ESD. In particular situations where the polyp is too complex or is in a difficult location that may cause you a lot of discomfort, we might be needing to offer you what we call deep sedation or general anesthesia. This is delivered with the help of the anesthetist, and further detail will be given to you if that is truly your case. The actual ESD procedure is a bit lengthy. It may take anywhere from 2 to 4 hours, depending on the complexity of your polyp, basically the size of it and the location in your bowel. After the procedure is finished, you will be transferred to our endoscopy recovery unit, where our qualified nurses will monitor your observations to ensure you're well and fit to be discharged to go home. Rest assured that before your discharge, you will be receiving plenty of information with regards to what actually happened during the procedure, including our phone details with instructions on who and when to call if you develop any symptoms or side effects following the procedure.